Hello, my name is Heather Allstat, and today I'll be talking to you about technology in healthcare, and more specifically, digestible sensors. What exactly is a digestible sensor? A digestible sensor is a sensor that is the size of a grain of sand. It's actually made of silicone, which can be put into a pill or any type of consumables. So how does it work? Once digested, the sensor is triggered by stomach acid and transmit a signal to the patch that is placed on the patient's stomach. There is no battery in the sensor. Once the sensor is activated, it can tell the patient and physician everything from when it was consumed, determine physiological and behavioral metrics like heart rate, temperature, rest patterns, body position, and activity. Information from the sensor is about 95% accurate. All information gathered from this pill is then sent to a mobile app on the patient's phone and to the caregivers, with permission of course. And once the pill has gathered all the information it can, it then passes seamlessly through the body. Improvements and impact on healthcare. This technology will have a major impact on healthcare. It will help doctors adjust a patient's medication accordingly, like if they're responding to treatment or if the doctor will have to fix the dosage for the patient. Digestible sensors will also help in broadening the knowledge about certain ailments and how they affect the human body. It can also help in finding diseases in their early stage, which in return can help in fighting against these diseases. This will also help in giving the patient a more accurate prognosis. On top of all this, it helps the physician find out if the client is taking their medication properly. Then last but not least, it will also bring down the number of medication error deaths. Do you agree or disagree that the technology is improving healthcare in Canada? I agree that it will improve healthcare in Canada. For one, its small size will make it easier for people, especially those who have problems swallowing pills like myself, to manage and take. I agree with it because physicians will have a much clearer picture as to what's going on with the patient's body while receiving treatment and how the pills are affecting their body. They'll also be able to see in real time some of the consequences of some diseases and see to some extent that the damage has been done to the body. It can also tell the doctor if someone is abusing their body with prescription drugs or illegal drugs and just how much damage has been done to it. Another reason I agree with it is because if a client forgets or just doesn't want to take the pill, the physician will know right away through the data that is sent to the patch and the mobile app, thus letting the physician know that there may be other factors to this patient, like maybe memory loss or the client just isn't taking his or her health seriously enough. Or if a patient is mixing pills with alcohol, which could further damage their health, On top of that, this will also help in reducing the amount of invasive procedures that the patients will have to go through. This will be beneficial for people who don't want cameras put inside of them, or for those who are afraid of these procedures. The third reason I agree with this technology is that I believe this technology will help improve not only the accuracy of diagnosing illnesses, but catching them earlier on. We all know physicians are humans, and they unfortunately make mistakes. So with the help of this sensor, it'll definitely limit those mistakes and eliminate the guessing game when you're just talk to the physician about some symptoms you're having. I believe this will help in getting patients into earlier treatments and ultimately being able to nip some diseases in the bud before they get too out of control. All in all, this technology will certainly help the healthcare system in Canada and also the world, and improve the lives of patients, resulting in accurate diagnosis, which will ultimately save more lives in the end. While I've never personally heard about digestible sensors until this project, the benefits from digestible sensors are overwhelmingly positive, and I can see this becoming a more common procedure in the future. And now here's some fun facts about digestible sensors. Some sensors are about 1 square millimeter in size and covered with copper and magnesium, which is good for the human body, while others can be a tad bit bigger, like the PillCam colon. Those are about the size of a fish oil supplement. Some manufacturers are taking extra steps in helping people to remember their pills by creating pill bottles that can alert a patient when they've forgotten their pill or when they're getting low on their medication. And currently, manufacturers are currently working on a sensor that can